probably the biggest driver of of stress was the anticipation, what to expect. Are we going to be the next New York? Are we going to see what we saw in Italy? Are we going to contract COVID ourselves? Are we going to bring it home to our families? There's a lot of unknowns. And then we weren't overwhelmed by numbers by any means, but it became fairly clear early on that we were able to protect ourselves. As we progressed through that first wave, you could see the nerves start to settle down. There were other challenges too. One of the more difficult scenarios were how people were separated from their families, and seeing loved ones die alone at times, I think was a challenging aspect of the care. Yeah. The vaccines was this how do I put it? It was like this another huge relief, like this godsend. It was like, wow, less than a year into the pandemic, and we have this tool that's going to prevent people from getting sick, and another layer of protecting for ourselves. It was just this huge, this relief. You could feel a sigh. What I've always said with the pandemic response is that we have to look at it holistically. There's going to be, how your intervention or your restriction is going to have some impacts on that'll be unintended, and how do you mitigate that? And it was tragic in that first wave. You'd see, BIPOC community being hit the hardest. You would see people that were essential workers, people that didn't have the option to stay home, as everyone was saying. They're the ones that are your Uber drivers. They're the ones, at the nursing homes, the personal support workers. Yeah. They're living in multi-generational homes, and this is part of the frustration. I feel like with COVID, like it really did discriminate when it came to severe outcomes. So really, I've been saying this from the beginning, let's reverse engineer this. Who lands in ICU? And let's make sure they get all the tools that they need to prevent them from doing that. So early in the pandemic, there was a big proponent of paid leave, and that was why, when you got to make a decision between getting a COVID test or going to work so you make sure it ends meet, what are most people going to do? And then, ironically, you're in a multi-generational home, and maybe the essential worker wasn't at risk of dying from COVID, but their mom was. Yeah. And then the whole house gets it, and it was very, we were seeing it everywhere. The holistic theme is something that's important to me, to really think about how, not just one aspect of health, but mental health, physical health, cancer screening, cardiovascular health, stroke, all these things are impacted by our policies, and we need to address them as well. Even when the vaccine started to roll out, target specific high-risk areas, brilliant. And OPH's messaging, the strategies, I think they really, like Vera and company, deserve I don't know, some, I want to say a medal, but that's not good enough, accolades when this is said and done. One of the things that I'm so proud of the medical community has been, we've been adaptable. Not to sound too pessimistic, but I think we're slow to adapt to change traditionally in medicine. And knowing that where we'd see the latest information and the latest data, and us responding to it, being like, okay, we need to put our patients on steroids. We need to put them on blood thinners. We need to be more proactive at putting them on their stomachs for improve their oxygenation. How adaptable we were, I hope we look at that moving forward. When it comes to our responses, it really has to be about the data. What does the data tell us? I would love to avoid any politicalization when it comes to COVID response. It really needs to be about what is the data telling us, and let's focus our interventions on people that need it the most. Overall, it just showed us where our holes in our healthcare system are. We all saw the negative impact on long-term care, in terms of hospital, overall, when we look at capacity, to take care of critically ill, we know how vulnerable we were as a province. I think all these things, are lessons that I hope we can take away moving forward. And I do think we are learning. I have confidence that seeing these things, we are going to try and address them because it's too important. A lot of heroes out there. They really were. Like considering what was at stake and, working the hours they did, 12 hours in PPE at the bedside of the patient and trying their best to, care for them and like they really were heroes. The nurses, the respiratory therapists, physiotherapists, those that were having to be like at the bedside for hours and hours, like those were really the heroes when you look back at all of this.